Understanding Atrial Fibrillation with Insights from the 2020 for ESC Guidelines. Welcome to MedEd 360. If you are new to the channel, kindly subscribe and please like this video. Today, we are going to cover the following. A brief introduction, followed by what makes atrial fibrillation serious. What are the key drivers of AF? We will talk about the AF care framework. We'll touch briefly on how to empower our patients. And lastly, we'll discuss the STEER AF initiative. Let's begin. Atrial fibrillation, or AF, is one of the most common heart conditions, significantly impacting both primary and secondary healthcare. With the aging population, rising comorbidities, and advances in detection technologies, the prevalence of AF is expected to double in the coming decades. AF is common, but what makes AF serious? AF affects patients differently, but its consequences are universally concerning. From debilitating symptoms to an increased risk of strokes, heart failure, and other thromboembolic events, AF has far-reaching implications. Emerging evidence even links AF to silent cerebral damage, which may contribute to conditions like vascular dementia. What are the key drivers of AF? The onset and progression of AF are driven by underlying health conditions and risk factors, including diabetes, hypertension, and obesity. If not managed early and effectively, these drivers create a cycle of recurrent AF, treatment failures, and worsening outcomes. Now let's discuss one of the key components of the latest ESC guidelines on AF, that is the AF care framework. The 2020 European Society of Cardiology guidelines emphasize a patient-focused, comprehensive approach with the AF care framework. The care framework consists of C. In the care stands for managing comorbidities and risk factors responsible for AF. The S stands for avoiding stroke and thromboembolism. Reduce symptoms of AF by controlling rate and rhythm. E for evaluation and dynamic reassessment. This framework places comorbidities and risk factors at the center of management, making it applicable to all patients with AF, regardless of their symptoms or thromboembolic risks. Now let's talk about how we can empower our patients. Patient empowerment is crucial. Involving patients in shared decision-making not only improves adherence, but also ensures timely medical guidance for changing conditions. This patient-centric approach is vital in tailoring management plans for better outcomes and quality of life. While the importance of adhering to clinical guidelines for AF management is widely recognized, putting these guidelines into consistent practice is often a significant challenge. This is where the ESC STEER AF initiative comes into focus. STEER AF stands for Stroke Prevention and Rhythm Control Therapy. Evaluation of an educational program of the European Society of Cardiology in a cluster randomized trial in patients with atrial fibrillation. This ambitious project aims to address the gaps between evidence-based recommendations and real-world clinical practice. So what's the road ahead for AF? The future of AF care may move beyond current classifications like paroxysmal and permanent AF, focusing on personalized, pathology-based management. Until then, multidisciplinary teamwork and adherence to evidence-based recommendations remain vital. The 2020 for ESC guidelines provide a roadmap to improve the lives of AF patients. Whether you're a healthcare professional or a patient, education, awareness, and proactive management are key to better outcomes. To learn more, visit the ESC website or explore the patient-friendly version of these guidelines. Your health is in your hands. Let's manage AF together for a healthier tomorrow. If you like this video, kindly like it, share it with your friends and colleagues, and subscribe to the channel for more videos like this. Thank you all for the support.